the panel back up, Hero and Emily. Sure, it might be less. Well, it depends. It doesn't matter. They're discussing that now. You want everyone up here now? Okay. All right, so we're going to start with Emily, and then the panel will come up once Emily is done talking, and then there will be a nice chunk of a half hour for discussion. Thank you.
And this, I just turn on the slide.
Let me introduce Emily Vargas Barón, who many of you know. Go back is the red. Yeah. So Emily has been involved in the early childhood field for a very long time and has been a leader in working on the processes of countries in developing national ECD legislation, but also developing the national action plans and improving the implementation of their national ECD policies. So she's had positions at a variety of places, including USAID as the director for a Center for Human Capacity Development there, at UNESCO, at the Ford Foundation, has worked in, I would say, virtually every region of the world around these policy development and improvement processes. And I think what's very impressive about her work is it's very stakeholder driven. It's about the process. As much as it is about the outcome. So we asked her to provide some comments from her perspective on these presentations around measurement of both quality and child development, health, and learning. Thanks, Emily.
Thank you. Is this, oh, it is on. Well, I'm going to admit to you that I feel very humble before the challenge. This is a huge question, a huge challenge for all of us to think of what is needed around the world from all the countries with regard to early childhood development and early childhood intervention policy and various types of programmatic implications that are involved. I actually began my work in measurement in Colombia in 1972, to date myself, working with Dave Weichert and others in the precursor to Sally McGregor's work in Jamaica. So we were using the Griffiths, and it was quite, and then Charlie Suber did some work with Jose Obdulio Mora that resulted in some articles that I highly recommend that you read for the history of the development of the field. It's a very interesting area. Then later I began working on the CDAS, which is the Child Development Assessment Scale. So, and it too would pretend to be able to be used, but it is not as rich as some of the other scales, and it requires a lot of manipulatives, and it would be quite challenging. The instruments that were presented to you today really form a type of overlapping patchwork quilt. And yet there are many gaps in the quilt. And there are some experiences that weren't presented. And I would like to pay homage to my friend Liliana Ullman, who has done superb work in Chile. You haven't heard about it, but she actually was able to assess the levels of child development in a population-based assessments, because she had two, and discovered the high levels of developmental delay by zone, which is region of Chile. It was formidably important. It ended up with a high impact in policy, and it formed what is now today the Chile Crece Contigo that continues on. And I wish to applaud her work, and she shows us how to do it. I wish that she would have presented because it's an important contribution. And also the work of Cecilia Breinbauer, who was a colleague in the work, who then carried it to Nicaragua and Honduras in population surveys that were national autochthonous population surveys like the DHS or the mix. And I think that we have really a lot of elements, and if anything, I will call for opening up the collaboration, bringing together more people to work around this so that we can learn from the best practices of all the work that has been done that were presented today and other things, and have a richer outcome for purposes of child development and policy. I'm going to speak today from the vantage point of national policy planning for ECD and ECI, and I'm going to look at this in an intersectoral way. We are working toward achieving now the SDGs and also achieving ECD and ECI objectives. Some nations will try to achieve and measure improved child development using future measurement capacities of the SDGs, but not all will. So we're going to have, again, a patchwork quilt of efforts around the world. ECI and ECD communities are, in any case, very, very challenged to improve their national measurement capacities, and they're trying to do so, oftentimes devoting very little money to that effort. Nations will continue to place their own needs first. Be very clear about that. We may see the global need, the need for comparison, but actually nations will be rather parochial. They'll look at what do we need to improve the development of children in our countries. Hopefully, they will adopt some of the SDG indicators when we develop them. And those measures that lie behind the indicators are extremely important. Most likely, nations will develop their own targets. They won't use international targets. As of June 2014, 68 nations had one or more ECD policy instruments. Now it's up about 74, 75. 10 were reliably reported 10 countries were reliably reported to have them, and 23 were preparing them. 60% of those 68 nations were lower and middle income countries, which I think is very telling. There is a tremendous drive that is real to work in the area of ECD and now increasingly ECI. Not all of the ECD policy instruments, however, included in indicators. Some consultants and people who worked with those countries did not include indicators. They're more policy statements than they are really strategic plans or full-blown policies. Some of them have many indicators. Now, with regard to the types of indicators, they tend to be predominantly operational or process indicators, mainly inputs and outputs that are essential for policy implementation. Again, they're being very self-interested in wanting to implement what they're doing. They have fewer outcome indicators. And especially I find this to be the case in this region. CECIS under the Soviet Union basically measured inputs and outputs and never outcomes, which is part of, I think, the reason for the downfall of the system. They didn't know what the impact of their decisions were. So one of the things that's very important is to inculcate, to develop a capacity to put into place systems for measuring outcomes and then use those outcomes for purposes of planning. The MDGs per se lacked an ECD goal. However, 7, not just 2, 7 of the 8 goals had ECD-related indicators. When you look at the indicators list, which is rarely published, you will find them. And in a book I wrote in 2005, you'll find them listed there. So we use those under the MDGs as proxies for a lot of the work we do. For example, stunting is one of the major ones. Many MDG indicators were measured at both national and global levels, such as infant mortality. That probably will not be the case with a lot of the SDGs. The SDGs present an opportunity for us, if we're wise, if we're strategic, to have effective ECD and ECI outcome indicators. Now, actually, ECD is under more areas of the SDGs than you realize. Poverty, there are 4 different areas. Young children living in poverty, services for children in poverty, resources. Nutrition and food security, I won't read them all, but there are 2 under there. Health and well-being, there are 2. Education, there are 4. Gender, there is 1. Then water and sanitation. Water and sanitation is critically important for ECD. This is where you get your waterborne diseases that are so terrible. And there is a direct relationship between water and sanitation quality and child development quality. reduce inequality within and between nations. There's one on child rights, which is for us. And then safe, resilient, and sustainable settlements. There we go, for children and women, and they're mentioned. Peaceful and inclusive societies, the 16.2, but also 16.9. So we do have an opportunity, if we look at it very carefully and study it, to have an influence in those areas. We may not do it on the first round of indicators, but we know from the experience of the MDGs that it wasn't all done in the first round. It took about 5 years, four years, under the MDGs to get the full list of indicators out and used around the world. So don't get so worried about, gee, we got to do it this year. It's going to be an evolutionary process. Key issues. ECD specialists realize, and others don't, that the quality early childhood development means so much more than appears in its write-up. And I'd like to point out something that's become a real problem, because we all want learning. 10 years ago, I fought for education all to be learning for all, and I lost. And now we've got a learning emphasis in education for all, which delights me. But child learning is not the same as child development. It's a subset of child development. We have to take that broader view of child development. So if we only measure child learning, we're not going to be measuring child development. ECD is not just 1 to 2 years of pre-primary or school readiness. It just simply isn't, and we have to say that over and over. And people in the UNESCO Institute of Statistics and World Bank and others are going to tell you, no, you have to use the time-proven measures that are basically input and output measures of coverage and how many teachers. Now, this isn't enough, and we have to fight that. Then ECD includes child health, nutrition, the sanitation area, I insist, education, rights, and protection. With regard to countries, national, regional, and municipal needs will come first. They want to know about their fragile birth status. They know that children have a whole series of areas that are important to be assessed at that level. Level of child development from infancy by age bands is wanted, just as Liliana did for Chile. They knew they needed to look at what is the level of our development in early age bands, 9 to 12, 18 to 24, et cetera, et cetera. So we have a tremendous need to really get into that period. I was thrilled to see the emphasis in the presentations today on the 0 to 3, as well as the 36 months and over. Malnutrition and chronic illness. I cannot emphasize the importance of that enough, and we know from the Lancet study, finally the message got through that we have to, that really stunting at the moderate to severe level is a proxy for developmental delay, and I use that constantly because it really is the case. Disabilities and atypical behaviors now are becoming of interest not only to ourselves but to countries, because they realize they don't have 2 to 4%. They really have around 40%, 50% when you add up all the different types of children's situations that cause developmental delays. Then disabilities and atypical behaviors. We had the wonderful presentation of the autism area. That's one of the areas of atypical behaviors. These are very important to be included, and countries know that. Policymakers know that now. High-risk status and child protection, ethnic and linguistic groups, moderate to severe poverty, you know the list. And then I was very pleased that we had presentations on ethical and rights considerations, the CRC, CRPD, child and family rights, confidentially informed consent issues. The General Comment 7 wasn't presented, but I want to call your attention again to that. Read it again. It is very much for us today as we work on this. Some nations are measuring only, as I mentioned, input and output indicators, and we need to put much more emphasis on outcomes. The outcome indicators are essential for measuring effectiveness, quality, equity, transparent accountability. Most nations that I have worked in are very interested in having good indicators and measures for ECD and ECI. The problem is they don't have the requisite expertise, and that is it. We really have a technical assistance role. I hate to use the term. It's a technical cooperation role, but countries do need more knowledge in not only what indicators, measures, and targets and how to set them, but also and how to validate instruments. Instrument validation is critical. We can't just develop instruments, we have to validate them. I won't go into how, but it just is very important. Then the ECD, MIS, and monitoring and evaluation database development is absolutely critical, and that's the weakest part, and is weak in all areas. We need to think about how will the measurement be used within national SDG plans. They're going to be done. Will they include ECD or not? Then within existing ECI, ECT, ECE, ECD, and IE, inclusive education policies, we need to be thinking about this. And then within new ones, and I think amendments are there needed, within new ones, we have a need for updating and getting additional ones. I want to tell you some additional challenges. We have a very chaotic list of SDGs, and we have a new series of quick and dirty indices that are being developed. One of them, I'll mention the Social Progress Index and the People's Report Card, and this has completely left out ECD and marginalized populations. Many more of these indices also are doing the same thing. So we have to work very hard to promote our area at this time. And we need to be involved in the national national SDG plans. That to me is going to be critical. We're not ready for it though. And it's going to take us, I think, at least 5 years to develop a good system of indicators. Rather than thinking we have to do it tomorrow, we should take our time and do it well. It's got to be done well. We should include policymakers and policy researchers in the effort. This should not only be done by measurement people. I love the way IDELA has taken the results and has shown the results to policymakers and gotten them to make changes. And indeed, that's what Liliana did. We need a research agenda. I have a series of suggestions that have to do with this that cover areas that you can read there, and another list here, but I'm down to 1 minute. So, and you'll notice that I cover all the areas, even birth registration and service access, because we really have to get new ones. We also need targets for government support for ECD and ECI at all levels. Remember, governments have to pay for most of this. And the final point I have is that leadership is needed for ECD, ECI, and measurement. For example, and this is from Enrique Peñalosa, the new mayor of, return mayor really, of Bogota, Colombia. Children are a kind of indicator species. If we can build a successful city for children, we will have a successful city for all people. And I love that one. Thank you.
Emily, thank you so much for taking the long view and providing the context for this. I think we're going to open up the questions, though, for everyone.
Okay, great.
From Abby through. So if everyone who is on the panel who has their name card up here could come up, and we'll start taking questions.
Is there enough to?
Great. So, questions for anyone on the panel. Though, if you are directing your questions to a particular person, please do so. And maybe we'll take these in groups of 2 or 3. Yes, Elia.
Me first?
First, yeah.
Okay. Well, thank you for so good panel and wonderful presentations. We could see here a lot of different kind of examples and point of view. I have some concern in terms of how always in many of the countries the measurement looks like an ending goal, like an ending goal. I think that the measurement is not an ending goal. It's maybe a an instrument to facilitate the possibility to prioritize, to identify the gap of inequity, to identify the needs, to identify the resources, or to identify the sector that must be involved in the design, implementation, and evaluation of policy programs, plans, and so on. I think that it maybe it's not really clear in the community that that are working in terms of measurement. That it's very important to look the early child development with an life cycle approach from the pregnant period to 8 years, okay? But all of us, we are very aware about the window of opportunity that represent the first years of life. I absolutely agree with your name, Ava. How is it? Because I absolutely agree with the idea of to recognize the opportunity that represent the health sector in terms of the opportunity to be in very close contact with the families, the community, and the children, of course, during a period of life where it's very common because vaccination, because diseases, because nutrition, and so on, very close to the health system. Then I think that it's very important to focus a big part of the strategies in the health sector and looking in a life cycle approach. Of course, it's necessary to go each period of the development is enriched by the other. Then it's important to have that vision, because when you apply a test, a screening test or an evaluation of ACD test, you are looking one moment, but you need to be close to the family and the children to follow up what is going on. This is one of my concerns. The question is, what do you think about the real possibility to work in an intersectoral approach, education and health, to complement, to produce indicators that could be useful for both sectors in terms of the needs of information, not only for SDGs, but also for the resources allocation, for public policy, and to have the possibility to make advocacy with the politician, for example, using indicators that are continuous. Not only one, it's not only learning. I absolutely agree with Emily, because it's more than this. Maybe one children can learn, but it's difficult to have friends or to cope with the problems or whatever, you know. Then I think that it's very important to have a more close relationship, not only in terms of indicator, but also in terms of intervention. This is my question is, because I was working in an international agency, and it was so difficult to work among all the agencies that are focused on children, or health, education, child rights, whatever. then this is my concern and my question. Thank you.
So a question about intersectoral approaches. If we could just take maybe one or two more done.
Thanks very much for a panel on measurement that generates this kind of positive energy and enthusiasm is a rare experience, and I appreciate having that experience with you today. And I appreciate my colleague Viba's openness around the facts of the very important work that her group has done, that 50% of the children who might have been studied were not studied because they were excluded, and we all know who those children are. So thank you, Viba, for your openness about it, and I'm wondering if other folks who have done the work could comment a little bit on whether that was their experience as well, and more importantly, what are we as a field going to do about this problem of the persistent, consistent exclusion of children so that we don't know about them, and that we do know about the other children is only half true in a certain way. And what do we do about that with all due respect to scientific rigor and R01 score points?
All right, let's take those two to start. Whoever wants to jump in.
There. Basically, that's what I'm calling for, is an intersectoral package of indicators that cuts across the SDGs, that includes health, nutrition, sanitation, protection, which the VAX gives us an opportunity to really work on that very beautifully, and then and they are also looking at policy implications again, which is wonderful, and of course education. So we have to unite. Not only that, the countries are uniting. When we work in an intersectoral manner in countries for ECD and ECI policies, we always are working intersectorally. We cannot do it otherwise. With regard to ECI, you have to integrate at the national level. It's one of the few programs that must be integrated at the national level as well as regional and local levels. A lot of ECD is integrated at regional or local levels only, but intersectoral in coordination, so at the national level. So yes, absolutely an intersectoral approach is needed, and it requires an opening of the mind and the heart, because those who are tied only to their particular sectoral orientation can't do it. And I have to say once again, congratulations to Chile, to you, because you put education and health under the Ministry of Planning. You got everybody together under the first administration of Bachelet, and were able to create it. And it's one of the very beautiful models of the world. I tell other people about it so they understand that it can be done if you want to do it. Obviously, the ministries remained ministries, but their coordination and their forms of making decisions were very intersectoral. Under the question of inclusion, critically important. And I too, congratulate you on making that point, because it was obvious from what I was reading. And obviously, we must open out to all of those people. I included both ECD and ECI because countries throughout the world, Holly and I have well found out, are moving into this area, including a few of the most low-income countries, but an awful lot of lower middle income and upper income, the upper middle income. So they want and need to be able to assess the degree of developmental delay or different types of disabilities or different types of high-risk situations that prevail in their countries. So we have to begin to have measures that will make it possible to ensure that the unincluded are included.
Dawn, I just want to clarify something. We excluded 50% of the sample from our prescriptive sample data to create the tool to see how healthy children develop across 4 countries. That sample is not excluded from being studied. We are definitely studying that data. In fact, we have an additional small sample of about 200 children with disabilities who we are adding to that mix. So I just want to clarify
Yeah, thanks. And one more response to the question about inclusion in measurement. So I think it's more of a plea, which is that if we can figure out how to integrate tools so that we're creating a developmental scale that runs from very early in life up through age 8, then we'll have a much better chance of making sure that each child is measured according to one system, which then can make sure that they're counted. So I think that we're working on technical ways that we can merge the data, and I'm also, within the education community, also trying to make this plea that instead of just measuring second graders on a very narrow band of academic skills, that there's a developmental approach. Even to the point where I was at one meeting and I was talking about this, and I heard somebody at the coffee break say, who invited the developmental psychologist? And so just to say, it's not an easy sell, and we're doing our best and appreciate cooperation.
I can just share an example of what this actually looks like on the ground. The partnership between education and health. So I had the opportunity to learn about what's being developed in the UK. So education and health are coming together. It's being decentralized to the local authorities, and they have the Great Home Visiting Program in England with the nurses, and they're joining up with the early years workers. And so what that looks like on the ground is that families are completing the ages and stages questionnaire. It's not being used so much as a screening tool for referral, but seeing how many kids appear on track or off track in their development. But it is really a partnership between the sectors and absolutely with the families, and they are including children with disabilities. However, this is a sensitive area, because imagine that family's experience filling out a questionnaire and marking not yet, not yet, not yet. And so that is something that they're really wrestling with, but luckily they can fill that out through observation, and they have a lot of training so they can maintain a positive relationship with the family and not make them feel terrible while completing it, which I think is really important. But just to say that those children are not being excluded, the information is being used at the policy level to try to help them understand what kind of additional supports are needed within the communities and why certain boroughs may have higher rates of delay.
I just wanted to make the point that an intersectoral approach to indicators has to cut across the major contexts of children's lives. So we have items for sanitation within a center-based learning environment measure. That would also go for family-based and informal care. That would also go for household-level access to sanitation. It would also go to what community health workers do to increase. So just to say that I think we need to think of this from really the child's perspective. And I know the Van Leer Foundation now has a new initiative of cities from the standpoint of children, like a 3-year-old child. And that's when you start feeling like that's the unifying factor, so it's less overwhelming to think about how do we measure a particular issue like protection, sanitation, nutrition, or health, which are both inputs. They are inputs, outputs, and outcomes, right? So this is the task before us. Take the next set of items. Jocelyn, I'm relying on Jocelyn on the order. Yeah. So Carolina, and then I'm just going to go wherever Jocelyn tells us to.
Okay. I have 2 questions from Constanza, from Colombia. The first one is, how can we have a set of tools that really measure the comprehensive development of the child that is different than an intersectoral set of tools? And the second question is, if those kind of tools that we have seen centered in psychological development are enough to evaluate a public policy.
Okay. Great question. What set of tools are sufficient to evaluate a public policy? Lorraine?
Thank you for a really fascinating session. And of course, it's vital that we have measurement. You're not the unwanted child. I would also tell you that researchers are very, very keen on this dialogue, not just for the SDG implications, but because we sort of, as a group who work in Africa, are quite fed up with having to pay for measurement. And we've actually decided, amongst a large cohort of us, that we're only going to use free online access. No longer will we pay hundreds of dollars for photocopying of a piece of paper to tick against we believe immunization is free, we believe primary school education should be free, and we believe that these indicators should be free. So I was thrilled to see what you were doing, and I wondered if anyone had any comment about advice to the SDGs about using free measurement rather than paid for scales.
Thanks, Lorraine. There's one back right behind. Or no, here? Okay.
Thanks. I wanted to pick up on Don's comment and also the comment of our IBM colleague earlier, and maybe picking up on my hang-up that I expressed a little bit last night. Speaking about exclusion, and as much as I appreciate all of these, there's sort of I feel like we're treating family care a little bit like oxygen. We're taking it for granted, and it's something that you don't notice the absence of until it's missing, and then you see the absolutely devastating effects. I appreciate that there are very few measures for children living outside of family care. There's some good recapture efforts of street children and children in institutions, children who are trafficked, children who are forced from their families for forced labor. And it'll be very difficult to get a holistic picture of those children. But I think what my request is quite simple of this group, and that's just merely to recognize that we're missing an absolutely important, most vulnerable population. The absence of that recognition, I think, in the SDGs, the absence of the word family, is setting people like us backwards. And picking up on the IBM comments, I'm thinking of the work we did to reintegrate children who were separated from their families during the Civil War in Angola, and we had to use tree trunks to list their names. And they didn't have birth registrations. We didn't know where they were from, and we had to use the songs they would sing to recognize which village they might have come from. So that's a pretty basic, how is this data working for the population? And similarly, in Haiti, I've worked with a kid who's 12 years old who was separated after the earthquake for 5 years, living in an institution that is not registered. His birth is not registered. He has no idea if he has family members living who may be looking for him. There is zero data. Nobody's accountable to that institution or to the children living inside it. So I would just ask that we, knowing that these are huge data gaps and there's little that we can do to really fill them, to at least acknowledge that we need to make a little bit of progress, maybe starting with just a recognition of the gap.
Thank you. Why don't we take those three from the panel first? Yeah.
First of all, with regard to Eliana's comment, rather than talk about the tools, because I think there are a lot of intersectoral approaches that we could be taking, on evaluation of policy. This is Constanza's comment. Obviously, we have tools of policy analysis, but really what we're talking about here is policy implementation, and are we achieving our objectives of policy, of strategic plans? Are we achieving the strategic priorities that are underneath those objectives? These are measurable. If there are indicators within the national policies, strategic plans, protocols, various legal instruments, laws in some cases. And I think it's very important that those be put into place at the time of the law or the policy being developed. They have to be in there so that you have a built-in way to analyze whether you're achieving your policy goals or not. It's totally doable. The thing is to ensure the countries do it, and not all people who work with countries in this area do that, and I think it's extremely important. With regard to low cost or free measurements, I think that measurements should be low to free. I will say there is always a cost. There is a cost for simply you not only have to get the instrument, you have to field test it, you have to translate, adapt it, you have to revise it, maybe go back again 3 or 4 times. Everybody's nodding, you've been into it a lot. And there's a cost to that. And then there's a great big cost, and it's an important one. It's called training. pre and in-service training. You have to have your supervisors as well as the people doing the work, not only at a programmatic level, but at a population level work. You have your enumerators and and it becomes extremely costly to do that, to do it well, but not too costly. I think it's very important that we realize the Battelle is a $1,000 thing. The ASQ is very cheap, very low cost. But the reason they have any cost to it is to cover their costs and to ensure that good training is involved and good adaptation. So Holly can talk more to that, but it becomes a very important thing to look at this in a holistic way with regard to costs and to build them into your policies in the cost categories, in the action plans, to make sure you have the costs covered there. And then ministries will say, aha, I will have to put that much money aside for doing this work. It is totally doable. It's just a question of being very forthright and saying this is going to be the cost of what you have. With regard to family development, a point after my heart, a very important area. And we have a series of measures. I didn't have time to talk to it. I think we need to do a great deal more work. The mix has a thing they call it an index. It's not an index. It's a series of items that came out of the old Caldwell home and have been reworked a little bit here and there, and they're not complete. And it's not an index. It does not tell you whether you have a highly stimulating home or not. It tells you whether or not the mothers read to the children or whatever. I think it's very important that we measure and we find or develop an agreed upon measure for home stimulation, home environments, home safety. Children have innumerable accidents and injuries due to lack of safety. You mentioned birth registration. I mentioned that a bit and going very fast. That is extremely important to ensure that we focus on birth registration. Your very existence is there. The children who die on the border of the United States and are buried in shoeboxes are children who never existed. They have no registration. It's extremely important that we find ways to bring that together. So, and we do talk about family. Maybe other people don't, but we talk about family because everything we do in ECD and ACI is parent and family based. So it's impossible not to do that. And we all had difficulty explaining that to people for all the reasons you know better than anybody. But I think that it's extremely important that we keep a focus on that, but then we have to fight to be able to have some indicators in those areas. Because right now, nobody's talking about it. They're down to a very small group of pre-primary things and maybe a school readiness indicator. I mean, that's not an ECD. Thank you.
A couple of things. I wanted to comment on the question around the way I heard the question around the child development tools, which is one that we've been thinking a lot at Save the Children, is can child development outcomes tell us something about policy implementation, and what do they tell us? And I think what we're finding is that having child level outcome tells us a lot about things that might be working well, and also things that might not be working so well, but it doesn't tell us enough about where the gaps and the issues are in the actual implementation of a policy. And that's why I really liked Abby's slide with the arrows going backwards, really showing the importance of being able to monitor and say something about that continuum between the policy and what's actually happening at the child level. But again, the child level outcomes are a great starting point to have a discussion and to start looking at the process of what's happening and at what point in the policy implementation things might be breaking down, and then starting to address some of those barriers and issues that we're facing. If we only had the policy, that also might not be enough because there might be well-implemented policy with still poor outcomes for kids. So I really think it's bridging that divide that's really important. And I wanted to piggyback on Lorraine's comment. I think one of the reasons why we got into the whole measurement and development of IDELA was because we as an agency with 75 countries interested in tracking child outcomes couldn't find the tool that was affordable and that we didn't have to pay for. But I also agree with Emily's comments that there's costs that are not related to how much it actually costs to pay for the tool, but adaptation and training, of course, is a big part of using these tools on the ground and making sure they're culturally relevant and adapted. And the very last point about the exclusion and the sampling, we within our work, we haven't restricted our samples. It very much has been driven by the partners and by the teams that are developing the studies and wanting to answer specific questions. But it's very, very interesting to see that depending on how the sample was drawn, we see specific trends of kids being left out of those samples. And so certainly if you're looking at preschool-based samples or grade 1 samples, to your point, Don, earlier, we see a tiny, tiny percentage, less than 1% of kids with disabilities in that sample. And we know that national averages are much bigger than that. So if we're really interested in a representative sample, or kids really in the margins in really remote communities that are not reached by household surveys, with minority language, there's a lot of different factors. Those kids just don't end up being in the samples that we get from the countries. So I think for SDGs, what we're seeing is it's really important to, if we are looking at representative samples, sometimes to target the samples and to be more purposive in terms of getting this wider slice of the kids and really be able to define all these margins that we've been discussing.
I'll be very brief. I just wanted to touch on the point of children living in out-of-home care. So I've used the ASQ with foster families, with caregivers working inside institutions, and I think the way that I like to think about it is that a lot of the items, on the ASQ, which are developmental milestones, that's a language of the child. And if we think about it as their behaviors are the voice of the child, and I think that it's an opportunity to help us understand how that child is doing. And often, unfortunately, what we see when children are taken into care is they actually lose development. And it's a way for us to help listen to what's actually happening to them in reality, in a way to have a bigger conversation. I know we're talking about indicators, but I think, as Emily said, it's really important to have the training, and that for me, the tools are about having that local conversation with the people who are caring for that child and making sure that we have that team around the child. I would just like to encourage everyone to go to the resources that people have put in the Dropbox folders. I know that I have some additional resources, and there's quite an interesting article on use of the ASQ with indigenous populations and the type of adaptation that they went through to use it.
Okay, so Kimber has been clear. Time's up. But so I have one comment on the marketplace and the economics of testing and data, which is that it is a big, big business, and it absolutely requires money to develop tests. I think we all agree that they need to be open source and free, but we're dependent on private foundations and other sources to develop them. The second thing is that I would like to encourage all of us to think of a different way of data and information. So when we talk about these tests, we're really working on positivist notions of knowledge to reach back into graduate school, of one idea of having comparable and meeting certain test requirements. That's good, that's fine. But we also have this new opportunity with partners like our IBM colleague in the back to really be thinking about totally different ways of information, very different types of pieces that were collected through different means. And I think that in the next era, instead of thinking about expanding surveys, which I think we all naturally do, let's also think about ways that we can get short bursts of information on things that we haven't been able to measure before using technology.
Great. On that link to the afternoon sessions, I think I'm going to turn it over to Sarah and Liana to introduce what's happening over lunch. But first, I want to thank everyone on this panel, the planning committee, everyone who participated. This was, I think, a fabulous morning. So, and to all the great questions too. Thank you.
Okay, so this brings us to the formal close of the 1.5-day workshop, the 6th workshop of the Investing in Young Children Globally Forum. So we heard on the first day from Jonathan Tadras, we had a very good opening that focused very much on the Convention on the Rights of Children, and in a way grounded our work here over the last day and a half in a framework of rights. But I thought it was interesting that he brought into his presentation the Sustainable Development Goals, in a way bringing together both the rights and the development frameworks into one presentation, and comparing a rights framework with a development framework. And I know at the Open Society Foundations that's something we're always fighting to do well, and I think he did a great job of opening the meeting with that. We explored yesterday how rights and SDGs pertain to 4 groups who are at the margins. Those are children outside of family care, ethnic and linguistic minorities, children with developmental delays and disabilities, children, migrating children, or children of immigrants, refugee children. And I think one thing that tied all those presentations together was an emphasis on the crucial importance of data in awareness raising to make inequality visible. And around the Roma issue, Open Society Foundation once issued a report drawing attention to the fact that nobody's keeping data on Roma. Actually, no one's disaggregating data, and it was called No Data, No Progress. And we could have just as easily called that report No Data, No Problem, because if you can't see it, it doesn't exist. And I think that the presentations yesterday, in a way, made us all aware that we need more data. And I think what was interesting about today is that we learned a lot about a number of new ways that we can show the impact of marginalization on child development, and that we can really shine a light on children in the margins, and perhaps through the SDGs we might be able to motivate some action to let's say help them, fulfill their rights. So I hope that the event also illuminates areas for further scientific and programmatic attention. I've been reminded that there are a heap of World Bank reports out there that are available. So there is more data available, more information available to everybody outside. And I also want to let you know that the RACI reports that David Greger referred to should be arriving at some point during the day. So if you're here and you'd like to get one of those will be out in the same area today and also tomorrow for those of you that are here tomorrow. And I will just thank you for a wonderful couple of days and turn over to Ileana. Sorry.
No problem. Also from me, I would like, first of all, to thank all the presenters from yesterday, because I think you helped us achieve one of the aims of the forum, and hopefully colleagues, Kimber and her team can confirm. One of the aims was to have practical suggestions from practice so that research can be informed by practice as well in terms of new areas of focus. And I think an additional aim that was hopefully successfully met was that of networking and learning from each other across the different disciplines, across the different fields, again, so that we can bring closer research, practice and policy. And I think this closer cooperation and shared learning can help us achieve the cross-sectoral cooperation and coordination that was highlighted so much in many of your presentations. I wanted to link some of the messages to the work of ISA, and many of you know that ISA is a regional network, a membership association focusing on Europe and Central Asia. And I'm happy and proud that several of our members are here and were also among presenters. And our main focus is on quality and equity in early childhood. And we were encouraged to see this link throughout the work of the 1.5 days that we had here today. And I think it has informed our work a lot, and we hope that you go home with the same feeling for your own work, having participated in the forum. 2 examples, 2 initiatives of ISA's that I think will gain a lot by us being here and having this partnership with you. One is focusing on the workforce, an initiative that we are just about to launch in partnership with Results for Development, and with support from the Bernard Farlier Foundation for the preparatory phase. It's an initiative that will look at competencies, standards, support for improvement, but also the empowerment of the early childhood workforce, the recognition of the profession. Having been here at this forum, we take a lot of messages and I'm grateful for this opportunity, and I'm hoping that many of you will want to join this initiative. We're happy to share more information with you about that. And another ISA initiative that I'm very excited to tell you about, which I think will be greatly informed by this event, is our next year's conference, which will be on a related topic, which, early childhood in times of rapid change. And we would like to explore how do we define meaningful learning in these times of rapid change. We will explore the use of IT, both in teaching and learning, but also for professional development. And I've been encouraged to actually look out beyond the early childhood community and invite colleagues such as colleagues from IBM and other sectors to help this. So I'm hoping that each of you can go home with such new ways of looking at things, and also that by the work we will all do together after this event, we can continue the networking and the aim of shared learning which the forum has. And also to stress this component, this aim of the forum, the networking and shared learning, there are two events that follow now. One is a networking lunch, and another one is a networking session, one after the other. So the lunch will be, both of them will be in the Loretta room, and the networking session will start right after lunch. I should say also that we hope that the different groups that have come here together, the ISA network, the OSF network, the network of donors, will continue to stay in touch with the members of the forum. And I will be very happy to explore this with Kimber, how we can link also the regional networks more closely, perhaps, with the forum. And we all look forward to the report, which will be issued after this. And we hope that you all go home with a lot of good memories of Prague and of being together in this event. With this, I think we can close officially the forum, and Kimber will let us know more about the Ideas Camp.
Okay, thank you. Thanks to our partners, OSF and ISA. I think it's been a very rich and rewarding time here. And there's another network here that I think hasn't been mentioned. That's a Lumos. There's a lot of people here from Lumos, and I just want to recognize the Lumos folks as well, who were really instrumental in helping us do our planning. I did just want to mention briefly, I should probably ask Steve to come up. Do you want to talk about the Ideas Camp instead of me? I can do it, okay. Okay, I'll do my best, and you correct me if there's any missteps here. But so we've embarked on a new partnership of the forum with IBM, and so Steve Adler back there, if you're interested in talking a little bit more about this over the networking lunch or networking session, feel free to approach him. But him and his colleagues here in the Czech Republic, is Jan here? Okay, so they're floating around. They'll probably be here a little bit later. So Steve approached us after being with us in Ethiopia and giving a really stimulating and eye-opening talk on technology. Decided that it might be a good idea for us to sort of merge efforts, us being the content experts, knowing about child development, how to reach children at the margins, measurement, and so forth, and I say us as a group, to be able to capitalize on that content and figure out ways that we can harness that and those ideas into some technology to work on technological applications, particularly around a narrow area for this session, which is going to take place this afternoon at 3:30, which is why we need everybody to stay here from 3:30 until 5:30 or 6, to generate ideas on the Syrian refugee crisis. We talked about some of this yesterday. And I think IBM is very interested in working with us on trying to develop some technological solutions to this, using some of their tools and some of the things that they work with. And so I really encourage folks to stay. I encourage you to talk to Steve a little bit more about this. And Steve's going to come up. There's another component maybe in early 2016 you want to mention as well about the development.
Hi. I actually just wanted to say that the history of this idea started actually with Jocelyn, who came to me in Addis and asked how we might be able to use, what types of technology we could use to amplify the knowledge that all of you in the room have, which is amazing, but how could we get the rest of the world who doesn't have this knowledge to take advantage of it? And in the beginning, I think we explored ideas around video production and a YouTube channel, and then I shared with her and with Kimber some of the work that we're doing around the world running hackathons. Who's been to a hackathon? One? Yeah, that's why we thought hackathons would be good for you guys. Who knows what a hackathon is? Aside from Kimber. You guys don't know what a hackathon is? Never been to one? I hadn't been to one either. I guess about 3 years ago, a colleague of mine told me about this idea, hackathon. I thought it was a group of criminals hacking into computer networks. It sounds like it, doesn't it? No, it's not that at all. It's usually a civic group of developers. So in the last 10 years, we have seen an explosion of development talent, of IT talent around the world. There are millions of developers, and there are new languages in development. I'll just name some of them for you. I know that doesn't matter, but Ruby, Python, Perl, JavaScript. These languages enable really rapid development. When I started programming back in the 80s and 90s, we used COBOL, C++, assembler, and it took months to get something done. Today, they do things in hours. I went to a hackathon in San Francisco, my first one that Code for America organized. Code for America is a nonprofit group that organizes civic IT activities around the country. They have what are called brigades, and these brigades work on developing applications for cities with volunteers. And at the hackathon that I attended, the chief technology officer for San Francisco showed up with a USB stick. Who knows what a USB stick is? Just checking. He comes with a USB stick. And on the stick, he had the entire civil code from the city of San Francisco in a file. And he said, this is the data we're going to work with today. Has anybody ever read, he asked the audience, have you ever read the civic code, which is all the laws the city council had passed over the last 30 years. It was just 30 years. Nobody had ever read it before. And if you had wanted to see it in the past, you were talking about a stack of books this high. But now it was on a stick, it was on a file, several different formats, text, XML, different formats. He put it on GitHub. Do you know what GitHub is? Yeah. Yeah. GitHub is an open source repository of code that developers use to share ideas and knowledge around the world. It's a common place where developers deposit the code they're working on and invite other developers to help work with it. So it's this huge international collaborative environment where developers share the best ideas. And he put this code on GitHub, and he invited, there were 40 of us in the room. Everybody had pizza and beer. And we all split up into groups, and we brainstormed what could we do with this code, with this data, not this bottle opener. And I sat down. I walked in dressed like this, sort of, like an IBM guy. Everyone else was in jeans and T-shirts and relaxed. And within 3 hours, they developed applications, sample applications. The team I worked with had developed a semantic search engine, which is like Google search engine, which searches on keywords. And it was designed to search through the civil code to identify all of the powers that the city council had provided to city officers in the code, like How much power does the sheriff have, the ombudsman, the mayor, the city councilman? Over 30 years of civic code, there's a lot of power there. And so they built the search engine. What was remarkable was they did it in 3 hours. And that's what's happening in cities and communities all around the world today. Governments are running these type of hackathons to generate new ideas and expand the role of government from being the center of authority and knowledge and power to a co-creation type of relationship with the public. And many of us around the world work together with governments to come up with new ideas that governments can't come up with on their own. And that's what I thought we could try to do together around your knowledge, is come up with new ideas for how technology can communicate what you know and the rest of the world needs to know. Now, the idea jam that we're going to do today won't have any developers. Instead, we're going to introduce to you some concepts of how we use technology. And I think we've already had a lot of really great discussions today and yesterday about data and data for early childhood development. And I would also say that I think I mentioned earlier, I'm an anchor partner in, there are these sustainable development goals. Everyone knows that. There's a global data partnership which we're forming with 38 partners from around the world. Colombia is a founding partner. Kenya, the government of Kenya is a founding partner. IBM is an anchor partner, and the purpose is to leverage data for fulfilling the Sustainable Development Goals. So one additional thing we could talk about this afternoon is the types of data you're already collecting that you could be bringing together to create richer narratives about children and their development to inspire change. So I hope we can explore that together this afternoon. I hope you'll all stay. We really need your participation. The idea for today is just to generate ideas together. We have a format for that. We're going to split you up. We're going to introduce all kinds of new terms and teach you about technology and challenge you to come up with new ideas. And I hope that in the future, in future forums like in Amman, Jordan, or in Toronto, or wherever else we're going to go, we'll be able to engage with large numbers of developers in universities and local communities to take the ideas we generate today and turn them into software and data and action. Okay? Good.
Okay, one more announcement I forgot for the forum members. At 1:30, you're not part of the networking session, so get all your networking out during lunch because I will be corralling you back into closed session to discuss and debrief. No, so the networking folks will be back here or in the Loretta room. Forum members will be in Belvedere. Okay? Thank you. You all have it on your agenda, I hope.